Colonial News Radio 700 WLW. Well, burnout may be a thing on your job. You may be a cubicle jockey or a radio talk show host, whatever it might be. And we have burnout. It's not that big a deal. If you're a doctor, if you're a physician, that's a different story entirely. Physician burnout is now a huge public health crisis, with nearly half of doctors experiencing symptoms of burnout. In a survey last year, found that almost 8 in 10 physicians reported feeling burned out. Burnout is real. It happens in every walk in everyday life. But, if you're in a position like this, I would put that at or near the top of the list for things we've got to address. Dr. James Pickney. Dr. James is a concierge medical practitioner, which means he doesn't have any stress. Is that right?
Well, I've got a little bit of stress, but not as much as traditional insurance doctor.
Yeah, okay, I got you, typically. Hey, Doc, good to have you on the show. We're all burned out, and it's fair to say most people working are burned out, and they roll their eyes and go, yeah, it must be really bad because, I guess you could just take a day off and go to your country club and, or maybe drive your yacht or something like that, and get away from things, whereas I've got to work 2 jobs or 3 jobs, as the case may be. So that does put it in perspective, but you're talking about people's health, though.
Yeah, and I think that's a misconception that doctors have yachts and Rolls Royces. We actually don't make that much money compared to the amount of schooling that we have to go through. But I think the point is, just like you said, when you're dealing with someone's health and potentially their life, especially when you're in the surgical suite or in the emergency room, burnout is a major issue that we have to combat.
Yeah, and how would you do that, though? Because, my mom is going through chemotherapy now, and even the nurses on the floor where she's at, it's amazing the shifts they work. It's 12-hour shifts. One of the better nurses she really likes there, I don't know if she's better, but she likes her, it seems like she works like 5 days, 6 days a week sometimes and working 12-hour shifts.
Yeah, and it is more challenging in the hospital setting because right now we are on that 12-hour shift. But I think in general, when we look at the insurance model and the way the system is set up, there's a lot of things that we can do for healthcare reform that can help prevent burnout. So one of the things that I like the most is taking out the third-party insurance payers from the system and reconnecting the patient and the physician. It's called direct primary care. It's a fantastic primary care model and really helps reinvigorate that patient-physician relationship, decrease burnout, increase time with your doctor, and helps increase positive outcomes.
Yeah, I've had a couple guys on the show here, Dr. Strickland and others who do that. And basically you pay, instead of getting insurance and Medicare and Medicaid involved in all the paperwork and layers of bureaucracy and headaches with compliance, essentially it's like the old days. I go to you and go, here, I got a sore throat. You take a look at me, and then you just charge me, $20 or whatever it is, or a monthly stipend.
Yeah, you pay a monthly fee, so it's a capitated rate, and most direct primary care practices around the country are less than a cup of coffee a day. So if you can kick your Starbucks habit, then you can have a direct primary care doctor and that direct relationship with your physician, and you can really work on reversing chronic disease and really improving your health with that relationship. So it's a wonderful concept. It provides better satisfaction for the doctors. They have a higher quality of life. They're spending less time charting and doing all the things that it takes to see a patient in the insurance model. We spend about 60 cents on every dollar just collecting claims in the insurance model. So that's a huge waste and inefficiency. Right. And as well as the amount of time that's actually spent with the patients. The national average is 8 minutes for a doctor visit. And that's not enough time to do anything. I can't establish rapport. I can't get to know you. I can't really dive into lifestyle and behavioral changes in 8 minutes. It's impossible.
Yeah, and it's interesting because my doctor, who's an OD, and it's through my health insurance, but he's like kind of old school. He'll sit there and talk to you for, 20 minutes or whatever, and there's times notoriously where he's backed up 2 or 3 hours in the afternoon because he is going to be done when he's done. So recently at Mercy, I think whose practices through is say they changed it and essentially hired an assistant to take all the vitals and stuff like that to let him do what he does, and that's medicine. That's really going to decrease burnout if more hospital systems do that, right?
That's exactly right, Scott. We really want to focus on the art of medicine, which has been lost. This is a major problem. 80% of doctors are feeling burnt out, and 60% actually are burnt out, and doctors are leaving medicine in droves. So right now we're facing a huge physician shortage. In the next 20 years, that physician shortage is going to balloon to 80 or 90,000 doctors. So that means decreased access to health care for everyone in America, and that's not a good thing.
No, not at all, too. So why are we moving towards a system? I guess before we even get to that, Dr. James Pickney runs a concierge medical practice and direct care, meaning we pay for the coverage, we pay for the care, as opposed to an insurance company. And you look at the tremendous cost involved here. It's all middleman who's making the money here, right? You have to hire people essentially to interpret the books, to interpret what the law is and what the restrictions, what you can and can't do in reporting. And how much does that add to your cost?
Yeah, the middleman is inflating the price for everyone dramatically, right? So most of that actually is going to the consumer, and we receive decreased reimbursements to the doctor. So if you can cut off that bureaucracy, that middleman, that inflation, you can actually save 70, 80, 90%. And that's exactly what we do at Diamond Physicians here in Dallas, Texas, and direct primary care practices all over the country. So we go and negotiate cash pay rates with imaging centers, with laboratories, so that the consumer, the patient, can receive these unbelievable discounts. So I can get an MRI for $350 instead of $3,000, an X-ray for $60 instead of $500, a lipid check, which is a cholesterol panel, for $4 instead of $125, and the list goes on and on. But when you start multiplying these discounts across hundreds of thousands of people, you can save the system a tremendous amount of money. And again, we spend almost 18% of our GDP as a country on healthcare, which is $3.3 trillion, more than any other industrialized country, but we don't have the best outcomes. We have the 17th best outcomes, which in my opinion, the greatest country in the world, is kind of sad.
It is, too. And you hear there are lawmakers who have been elected on a platform of Medicare for all, where everyone... Is that going to keep the cost low, or is that going to drive costs up?
Yeah, a universal payer system, a single payer system, is going to drive costs up in the long run. It may decrease costs in the short run, but the quality of care and outcomes are going to plummet. People are going to have to wait even longer. We've seen that in systems like Canada and in the UK. That's not something that we want to replicate. What we want to do is shift to a free market healthcare system, just like all other industries, consumer industries. When you have competition, when you have big box retailers battling online retailers for pricing, the price goes down. If you don't know the true cost of a good that you're selling or a service, then you can't have any competition. You have no price transparency in the marketplace, and that's the problem with healthcare. If we knew the cost of care, if you knew that a cholesterol check was $4, then you wouldn't go to a lab and pay $128. No. You would go find a lab that charges $4 or $5. But because those costs are hidden from consumers, that's how the middlemen can continue to mark up prices and basically fleece America. And it's sad, and it's something that I'm very passionate about at Diamond, and something that we're trying to combat with our Diamond Direct Care Network, which is a national network of DPC physicians that will allow patients around the country to find the doctors in their area, connect, and plug into these DPC systems so that they can save money and receive better care.
Yeah, and you're talking $4 for a lipid profile, which, of course, when you hit a certain age, you're getting that done anyway to make sure your cholesterol's fine and all that. And you're saying if I were just to pay you directly, doctor, it costs about $4. But when I whip out my insurance card and say, yeah, I'll put on my insurance has got this, they're billing that insurance company some $400. This is why the cost of healthcare is out of control. It's not the real cost. It's inflated by how many fingers touch that dollar bill.
That's exactly right. And until we make a stand as a country and say we're not going to tolerate the pharmaceutical companies and the laboratory companies and the imaging companies and even the insurance companies who often charge a 4% admin fee on top of the charges for administering claims to all these CPAs and different companies, we're going to have to say, look, we're not going to take this anymore. You guys are going to have to inject price transparency in the marketplace, tell us and show us what you are doing, and we're going to go back to our relationships with our doctors, and we're going to use insurance the right way. Insurance is a risk mitigation tool. It is not designed for primary care. It is designed for catastrophic issues, hospitalizations, surgeries. If you get in a car accident and break a leg, you use your insurance if it costs tens of thousands of dollars. Do not use your insurance for a flu shot because the cost rises from $10 to $60.
Yeah. Well, I have homeowners insurance, right? And it would be like this. If I used my homeowners insurance the way I use my health insurance, Dr. James Pickney, basically when a light bulb went out, I would call the insurance company and have them get me a light bulb. When I needed a filter change for my furnace, same thing. If I needed the grass cut or, I don't know, a faucet's dripping or something like that, I would just go through my insurance company, which of course would cost a tremendous amount of money because you're adding intermediaries here, as opposed to just going to the store and going right to the retailer and paying, $3 for a light bulb. I'm going to go to someone else who's going to do it for me and charge me $300 for the light bulb.
It's a great analogy, Scott. And I love the car analogy as well. I always say that, when you fill up your car with gas or need new windshield wipers or new tires, you pay cash. When you get in an accident that costs tens of thousands of dollars, that's when you file an insurance claim and you pay your deductible. If you paid your gas with an insurance product, your gasoline would be through the roof.
Right.
Your insurance premiums would be through the roof.
Yeah, it doesn't make any sense whatsoever, and yet the same people clamoring the solution is more insurance, not less insurance. And it seems to me if we all paid out of pocket directly, we'd probably be better stewards of our own health, wouldn't we?
Absolutely. You would actually seize control of your health. And if you had the ability to shop around and look at different competitive pricing, you would actually receive better service as well. The experience is so bad in healthcare because it doesn't have to be great. There's no competition. So I don't have to provide that higher level of service. In DPC, we do, because we are battling to attract and retain memberships. So if I don't do a good job and I make you wait for 2 hours, Scott, in my office, you're going to go somewhere else.
Yeah. Yeah, no question about it, because my time is valuable, even though I don't have anything going on. Dr. James Pickney is a concierge medical practitioner down in Dallas, and he's part of a system, and we've talked about before with some local folks up here, that does direct care, and meaning that there's no insurance. You pay a monthly stipend to the physician. You get obviously a limited number of office visits, and a lot of the stuff is included too, and it's a lot cheaper actually than in some cases having insurance, and you're out of pocket there, which begs the question, why don't we do it this way? This is the solution to fixing the healthcare system. More insurance is not the answer. Less insurance is, and then having for catastrophic occurrences, much like you would a car or a house fire, it's there if you get cancer, something along those lines as well. So someone may go, well, this sounds all well and good, but what happens if I have a chronic, debilitating, long-term illness and I'm diagnosed with that? What happens then, smart guy?
Well, you still have to have that direct relationship with your primary care physician.
Right.
So any long-term chronic condition has to be managed by your PCP. If you need a specialist, we can facilitate a specialist visit. But at the end of the day, you need coordination of care. You need continuity of care. And that relationship is dictated by the primary care doc. 60% of America don't have a primary care doc. So at the end of the day, we are the cornerstone. The primary care physician is the cornerstone of our medical healthcare system. And if we lose primary care, the whole system will crumble.
Yeah, and that's what we're talking about this morning. Studies are out saying physician burnout, it is an all-time high, a huge public health crisis, that nearly half of doctors are burnt out. And a survey last year found that 8 in 10 have symptoms and reported feeling burned out, which basically means your care is going to suffer if you're burned out and the physician is disengaged. A lot of jobs you probably could slough through and be fine with some burnout, but as a physician, as a medical practitioner, I kind of need you at the top of your game in order to keep me alive. You know what I'm saying?
Yeah, you want us to be happy. You want us to want to be there and want to take care of you, because at the end of the day, if your physician is unhappy and burnt out and depressed, we actually have one of the highest rates of suicide with any white-collar profession. One doctor commits suicide every day, and that's a travesty. You want us to be on top of our game and ready to go each and every day so that we can provide the very best care to you. A lot of times, your life may be on the line, especially in the surgical suite, in the emergency room. You want those docs to be ready to go.
And you often hear it is that doctors, physicians like yourself, Dr. James, they get into help people. They want to help the human condition. They want to have people thrive and feel better and have them cured through their magic touch and science, obviously, right? They didn't sign up for dealing with Medicare, Medicaid, insurance companies, diagnostic codes, and that kind of stuff. That's what's adding the burnout, right? It's not the patient care. It's all the BS that goes into the patient care.
That's right. So we got into medicine to take care of people. And then once you get out of residency, you find out that there's all these ancillary factors and middlemen and third-party payers and systems in place that hinder our ability to take care of people. Direct primary care removes all those hindrances. It's just the doctor and the patient and a wonderful system of providing 80-90% discounts on labs and imaging, and then everything within our four walls is included. Unlimited visits. There's no copays. 24-hour access to your doctor. My clients have my cell phone number. They can email. They can video chat. We have an app that's HIPAA secure called Dr. Link that we're also launching nationwide, where we can communicate with our patients when they travel. And that's what it's all about. It's about that direct relationship and decreasing the chronic disease, incidence of chronic disease, decreasing hospitalizations, decreasing ER visits, and increasing outcomes.
Yeah, and it sounds like that is a simple solution. So the question then, Doc, would be, well, why aren't there lawmakers that look at direct care like you have and go, here's our solution?
You know, we do have a bill on the floor of the Senate right now that would allow HSA accounts to pay for direct primary care services. I'm not sure when the Senate is going to vote on that bill, but it has passed the House. So that's one great step into allowing Americans to use tax deferred money and pay for direct primary care services. I was just at the Texas policy meeting in Austin in our state talking about Medicaid reform, and I think direct primary care is a great option for Medicaid reform. So we're making baby steps. You know, these things take time, Scott. Legislation sometimes moves very slow. So we're working on it. I'm working on it. There's a lot of doctors around the country that are fighting for you. There's a lot of politicians that are fighting for you. So I would encourage everyone to go to diamondphysicians.com and read more about direct primary care. You can go to DPC Coalition website and file petitions with your state representatives, your senators, and tell them, hey, look, we want direct primary care. Yep. Let's put laws in place to facilitate DPC.
Yeah, it's a small but growing movement here in Cincinnati. DiamondPhysicians.com, Dr. James Pickney. Thanks again for the time. Appreciate it.
No, thanks for having me on.
Yeah, and you know, when it comes to Medicare and we need Medicare for all, here's why I don't have a sense that if the government ever reopens, of course, that they're going to get this thing done, is because the insurance and drug company, big pharma lobby is so big that they're going to stop anything like this from happening, which is a damn crime, because look at the lives and the balance, look at the quality of life and the quality of our health care here in America. We should be at the top of the list, not at the middle of the pack, and we are because Washington, right? It's the Scott Sloan Show, News Radio 700 WLW.